Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, April 26th is Pennsylvania primary day. We're going to have an update on the big elections, but first, the challenges we face in long-term care. All of that's coming up after these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, wouldn't you know it, we have a primary coming up on April 26th. That will be here before too long. We've got some very important elections. But first, the challenges facing long-term care today. Joining me is Russ McDaid. He's the president and CEO of the Pennsylvania Healthcare Association. Russ, welcome to the program.
And thanks for having me, Terry. It's a pleasure to be here.
It's my pleasure having you here. All right, let's talk about, in general, the condition facing long-term care. There isn't any doubt that at one point a substantial number of people all over the country, but obviously in our state, end up in a long-term care facility. It could be for a substantial period of their life.
It could be.
What are their challenges? Yeah.
Well, first, I'd tell you it's a pleasure to join you and be here with you today. The reason I'm so excited about my new role as the president and CEO of Pennsylvania Healthcare Association is because long-term care is an issue that's going to impact all of us at some point, as you noted. And there is no shortage of challenges facing our residents who reside in our long-term care facilities and those who provide their care. One of the first pieces, Pennsylvania is an old state and we're growing older. Now, no matter how you cut it, we're in the top 4 nationally in the percentage of people age 65 and older, the percentage of people age 85 and older, which is where the long-term care need really begins. And we're going to see both of those populations over the next decade. They're projected to grow significantly. Our 65 and older population is going to grow by over 30% projected in the next decade. And our 85 plus population, the folks who really then begin to need the type of 24/7 skilled care that our members provide, is going to be closing in on 500,000 Pennsylvanians by that time. And it's going to be essential that we get this right.
Yeah, and I think there are 2 elements to that. I mean, one is that we need, as individuals and as family members, to prepare for this, and too often we don't. I mean, we're not immortal. I mean, we all maybe would like to be, as you know. And then there's the challenge that the health care facilities face in terms of getting the people, making sure there's access and there's enough of them and they're in the right locations. This is a pretty complex situation.
It is. And that, you mentioned the immortality piece. I mean, this is something nobody plans for. Yeah. I've got 2 high school daughters. We're spending a lot of time right now planning for their future and them heading off to college, what majors they're going to pick, what schools are best. We spend a fraction of the time that any family spends on planning a vacation usually on choosing our long-term care. Yeah. And the same with our workforce. I mean, if we look at the big challenges facing our sector right now, 2 of the biggest, and the first one I think is workforce. We have that growing population of elders, and one of the ironies is we are living longer and staying healthy longer. 60 really is the new 50. People really are having more vibrant lives through their 60s into their 70s and even their 80s. Right. However, we now have many more people who reach 85, 90, 95, even 100 than we've ever had before, and they need care.
Here's what's also fascinating. I mean, I've had family members say, well, I'm going to keep you here, you're going to stay at home, and everybody means it, but we know at some point that just isn't possible, right?
We all mean it, and we all want to stay at home.
Right, sure.
I don't want to have to go to a hospital to have heart surgery if I have if I need a bypass. However, I want a high quality hospital to be there if I ever do find myself in that place. Yeah. Our nursing facilities are the same way. Nobody wants to need one. However, we know the reality is that over the course of someone's life, they're going to find themselves in need of, likely at some point, even if it's only for a small period of time, the type of 24/7 skilled care that our nursing facilities provide and that Medicaid pays for here in the state.
Yeah. Well, let's run to a break. When we come back, I want to talk, the governor's going to get, on February 9th, delivers his budget address. Let's get in a little bit to how does that make a difference for you? What does it mean for you? We're talking about the challenges facing long-term care today. We'll continue with that after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Well, welcome back to the program. Russ McDaid and I are chatting. He's from the Pennsylvania Healthcare Association. He heads that organization. I almost hate to mention the word budget, given what the state has just been through. Stopgap budget. We still don't have, quote, a final budget. I guess it may be the final budget. The governor's going to give his message. We're all awaiting that. Well, I have to ask you the big question. How did you fare in the battle that went on for 7 months before the stopgap was approved?
Yeah, it is funny. Most of us who've been around this for a while, budget season has taken on a whole new meaning this year.
Right, absolutely.
Actually, we fared well, all things being considered. And, the first piece is, our nursing facilities who are providing quality care to Medicaid individuals, to low-income individuals, have been being paid throughout the impasse as a result of some court rulings under prior years when we had a budget impasse, so that essential services are still paid for.
Right.
So those folks are still getting the care, and the people who provide the care are being paid for. We have flat funding in the governor's budget, but we didn't see a blue line, and that means that funding is going to flow.
Nothing remains flat, however.
Well, that's correct. That's correct. That's correct, and that's one of the challenges we see. Moving forward is how can we make those incremental additional investments in our low-income and elderly and people living with disabilities, living in our nursing facilities, so that they can receive the quality care that they deserve.
Now, give me an inkling of what is in the budget that obviously many of your people are on Medicaid, I would presume. Not in the facilities. I guess they start out on Medicare for 90 days, and then they would go to Medicaid if they're Medicaid. Now does that state or federal? That's the federal regulation, but
it's actually, Terry, you need to take a course in this just to be able to figure it out. And when it happens, families learn very quickly how complicated it is. The first 20 days in a facility, Medicare pays full freight.
Medicare.
Yeah. Right. Okay. Then day 21 to 100, Medicare pays partial freight, with the individual having to pick up the balance.
I'm already confused.
Yeah, that's right. And then day 101 on, you pay your own.
But look, you're doing an important. You're giving an important lesson here for the viewers out there. Many, parents looking at, or the kids looking at, what are we doing with the parents, and some folks with the grandparents. No, this is important, I think. All right. So, what are you looking for in the budget?
We'd love to see an increase. Obviously, that sounds overly simplistic, but it's the reality. Any increase is desperately needed by our nursing facilities. I know you've heard us say in the past when we've been here with you that their reimbursement from Medicaid falls far short of covering their cost of care.
Right.
It's around $23 a day short of covering the real cost of care so far. We expect to see that number go up again this year, so it's a real challenge. So any additional funding in the budget for nursing facilities, and we spend a lot of time in Harrisburg debating whether somebody ought to be served in their home or in a facility, when we really got to get past that and look at funding both. We need to work to open all doors, so when a family has a long-term care need, that all options are available to Pennsylvanians who need the state support.
Let's talk, before I let you go, let's talk a little bit about the quality of care in nursing homes. the state has a responsibility here. Talk about that a bit.
Yeah. Well, the state's involved in the quality of care very directly. The State Department of Health licenses our nursing homes. It's a very rigorous and thorough process. Inspectors come in at least once a year on unannounced inspections and check our operations out, make sure that we're meeting all the regulations, make sure that residents are getting the care that they deserve.
All right.
So that's a very thorough, process as it relates to quality. We're also continually looking at our own operations beyond the survey and saying, how are we doing in improving the health of the people we care for? And we track that over months and over years and say, are we doing better over the course of time, or are we falling behind? And then we address the issues where an individual facility might be falling behind, because our residents and the staff who provide their care deserve the very best, and we ought to be looking at that on an ongoing basis.
Well, look, I want to thank you for coming in. You'll come back and give us some periodic updates. All right, we'll see you. We'll see you in a few minutes when we're going to have Dave Patti, and he's going to talk about, and we're going to do an election preview. We'll get to that.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania, and by the Pennsylvania Coal Alliance, representing companies involved in America's most affordable, reliable energy source. To learn more, visit pacoalalliance.com.
Welcome back. Well, it's time for an election preview. We're going to start a series of them. Joining for this one, for this particular preview, is Dave Patti. He is the president and CEO of the Pennsylvania Business Council and quite an expert on Pennsylvania politics. He's been covering it for many years. All right, I got to start out with the Trump show. In the polls that others have done and I have done, Trump, Cruz, Rubio, right? Trump was still a pretty sizable lead.
Well, he said he could shoot somebody and it wouldn't matter.
I know.
And the audacity isn't so much the statement as the fact that it's correct. It probably wouldn't matter. So.
Yeah, I know. But here's the question. You know the electorate in this state. Do you think it's conceivable if we got to a primary, and who knows, oh my gosh, it's still months away, not weeks away. Could Donald Trump win Pennsylvania's voters, Republican voters?
Well, it's a lot closer in Pennsylvania than it is for him in other states.
Right.
And I don't think the bombast works as well here. Right. And then you also have some good ground games by other candidates, particularly those two that you mentioned, Cruz and Rubio.
Yeah.
Rubio in particular has long been the pick of the Republican National Committeeman from Pennsylvania, Bob Asher, on the basis of nothing else, that he doesn't do any harm to the rest of the candidates in Pennsylvania. Yeah. And you see... He
would actually be, I don't weigh in very much, but I think on the Republican side, he would be a very strong general election candidate.
He'd be a very strong candidate there. And again, he doesn't do any harm to the Pennsylvania candidates down ballot. So you see, Speaker Turzai last fall already got on that bandwagon. Senator Aument recently. But more and more state lawmakers are coming out for Rubio now.
Yeah. All right. Let's turn to the Democratic side. As we would expect, Hillary Clinton, her dad, born in Scranton, played football at Penn State. She claims Pennsylvania roots. She's very popular down, particularly in the Southeast. I think Governor Rendell was a big supporter of her.
In spite of an errant tweet this week that hat became hate. But
yeah, I know. I saw that myself. So she still leads Bernie Sanders convincingly, but he has picked up double-digit points on her just as nationally. Again, Pennsylvania looks like pulled up a mirror, right, and you're seeing our state.
Well, so let me give you some credit here. You had some polling out recently that shows that people are feeling alienated, disenfranchised. They're not part of the process. They're discouraged. There's another poll that says 53% of Americans aren't optimistic about the future. I mean, that's horrific.
Yeah.
And it's giving you this outsider push that gives Donald Trump and Bernie Sanders momentum. And she's the ultimate insider. I mean, it's funny to have the former First Lady, former Secretary of State trying to say, oh, I'm an outsider. It doesn't compute. And what
U.S. Senator.
Right, yeah. And,
right.
And what you have from Bernie is that connection to people who are just irritated with the way things are right now.
I think the difference is, I think it's still going to be tough for Sanders to be viable by the time it gets to here, by our state, April 26th. Even if he were to win Iowa and New Hampshire, once you move the primaries and caucus south and west.
Yeah, March 8th, the Super Tuesday.
Yeah.
When you go down there, I think that's
considerable African American support, Hispanic support for Hillary.
Right.
Going to be, but would you still say probably not to be a Democratic presidential primary? If you had a wager, would you say probably not? Or you think there's still an outside chance?
Well, I think the thing that would be interesting with momentum from him, if he comes off of Iowa and New Hampshire and has some momentum, what starts to happen? But the other thing is, a battleground state like Pennsylvania or a big state like Pennsylvania still matters because of the delegate count.
Yeah.
So, when you get here in April, it is conceivable that he picks off enough little states along the way that she doesn't have it yet and still has to really fight for Pennsylvania because she needs the delegates.
But more likely the Republican race. You
yes,
could easily see that
you could easily see
because of the way they change delegates being
right.
selected now, where you can't.
We pretend that winning a state means something, but it's really winning the delegates. And in some states, that's not winner take all.
Yeah, so. It's, for the Republicans, it's not at all until March 14, and for the Democrats, they've outlawed exactly. All right, so now let's go to what not arguably is one of the top 5 U.S. Senate elections in the country.
Right.
Very visible. We've got Pat Toomey elected in 2010 by 2 points. I think all things being even, I think it's going to be a little more difficult to defeat him than Democrats think.
Right.
Then we have 3 Democrats who are seeking to oppose him, who want to run against him. Joe Sestak, Katie McGinty, and John Fetterman. We're going to run to a break. When we come back, let's preview that and get a sense about that Democratic primary that still has a long way to go.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Business Council and by the Pennsylvania Business Council Education Foundation.
Welcome back, Election Preview with Dave Patti. We were in the midst of talking about one of the most important U.S. Senate races in the country. Obviously, Senator Toomey, end of his first term, up for a second term. Most of the analysts say maybe leans slightly Republican. He's got to worry about the top of the ticket and what that could do down ballot, as they say, with offices below, his being one of them. All right, this Democratic race looks like it has the potential to heat up. Joe Sestak, former congressman, you go ahead. Talk.
Well, yeah, so Joe Sestak, who was a career Navy man, retired as a 2-star, made it to 3-star, wasn't in rank long enough to be retired at that rank. But, Naval Academy, there are plenty of stories that he was not the greatest guy to work with in the Navy, but that notwithstanding, he got 2 stars.
Right.
And did 2 terms in Congress, had one in southeastern Pennsylvania, and chose not to run again so that he could challenge Arlen Specter against the party's wishes, and defeated Arlen Specter. This is when Arlen Specter changed parties.
Right.
And then went on to lose 6 years ago to Pat Toomey
narrowly.
By about 1.5%
2 points.
or something like that. So he felt like it was his turn to go again.
And he's been running ever since.
He's been running for, ever
walking
since.
over this state, right.
And the party doesn't want him to run. In fact, I have to say I felt a little sorry for him. This week he had he appeared at the Pennsylvania Press Club.
Yeah.
And because of the snow, there was a very small audience. But you know how when it's done, usually then all the reporters go running up to talk to the person. The reporters talked to themselves. There was no gaggle.
Okay.
They didn't care.
Let's talk.
So, Katie McGinty.
Katie McGinty, former chief of staff.
Yeah, I had a cup of coffee
Wolf.
with the governor. I don't know if she wanted the job. I mean, she came in and did 6 months with Governor Wolf and got out. She had run against Wolf and was the one who fared the worst in that. of those who stayed in the race.
Popular in Democratic Party circles.
Right, and daughter of a Philly cop, she went to St. Joe's, was a chemistry major, worked for Arco Chemical for a little while.
Has a good narrative.
Yeah, worked for Al Gore.
Al Gore and Bill Clinton.
Reputedly the ghost author of Al Gore's book, Earth and Balance. So she has environmental cred, environmental secretary here in Pennsylvania. So she's sort of kind of the darling of the party, but along comes John Fetterman. So the mayor of Braddock, 6'4", huge,
6'8",
bald,
I think.
tattooed.
Huge.
Compared to me, anybody's big, but he looks bigger every time you see him. And but Albright College undergrad and a graduate degree from Harvard. So he is this. A little bit of everything.
Yeah.
His wife and children live in a warehouse that he rehabbed into a loft apartment style thing in Braddock. He's making Braddock into a town for arts and
that's
foodies.
an old steel town in the Mon Valley.
Just outside of Pittsburgh, a shadow of its former self, but he's bringing it back. And so New Yorker Magazine and 60 Minutes have done all these things. Right.
And plus he endorsed Bernie Sanders.
Right.
And that cannot make the Democratic Party establishment happy.
But it's interesting that Marcel Grun, the Democrat State Committee chairman, even said, the guy to watch in this race is Fetterman.
So the Democratic State chairman praises
the guy
John
who's not their
Fetterman, and many of the Democratic kind of leaders around the state, I would think, are supporting. At least what we read is supporting.
Fetterman won't have the
McGinty.
money, but he will benefit from everything else.
Yeah.
And to your point, so control of the House or the Senate is always everything.
Yeah. And
there are 54 Republican senators currently.
Right.
So they don't have cloture at 60, but they have control of the committees.
They need 5 without the presidency.
Right. So the Democrats need to pick up 5. There are 34 up this year, of which I think 20 of them or 24 of them are Republicans and 10 Democrats.
That's right.
So it's tough it's a tougher year for the Republicans.
Yeah.
And so that's why Pat Toomey matters so much.
We're not going to have time to get into the row offices, State Treasurer, Auditor General, and help me out, Attorney General.
Attorney General.
So
there is that Attorney General thing.
Yeah, that's Attorney General thing.
She may have been talked about in the show
Attorney General
before.
Kathleen Kane faces all these legal problems. She's being sued by people who work for her and people who used to work in the AG's office. We're going to find out shortly whether she actually files for the race, right?
Right.
All right, but it looks like a hot and very competitive race in the office.
There are four people there, but including her, and the other 3 very credible. The current District Attorney of Allegheny County, Stephen Zappala, long-term Northampton County and perennial candidate John Morganelli, but he'd be a great Republican candidate.
And probably
frankly.
the party favorite.
Josh Shapiro, the Montgomery County Commissioner, never was the prosecutor. So Governor Wolf gave him a commission to run to try and give him some chops on this. But
with 30 seconds to go, but you would expect a competitive race.
Competitive race there. Yes, John Rafferty, the only Republican. But on the Democrat side, those 3 or 4 are going to be very competitive.
All right, great update. We'll see you next week for another edition of Pennsylvania Newsmakers. And as always, stay well.